We are now the sickest country in the world.
It is now believed that over 54% of our kids have a permanent chronic disease. Shouldn't we look closest at the one product designed to alter our immune system for life? There'd be one easy study to rule it out, the vaccinated versus unvaccinated study. The pharmaceutical industry has absolutely corrupted the entire scientific space. We have gone from 12% chronic illness in the 1980s in America to now over 54% of our kids are chronically sick. That is the greatest decline in public health that's ever been recorded. Every vaccine is arriving at your doctor's office with a warning label wrapped around it.
An Inconvenient Study is the latest groundbreaking documentary from Bigtree, founder of the Informed Consent Action Network, or ICAN, an organization that has successfully taken legal action against top U.S. health agencies, including the CDC and FDA, all in pursuit of one goal: true, informed consent. The film confronts a growing crisis head-on. Over half of American children now suffer from chronic health conditions, which signals a dramatic rise from just 12.8% in the 1980s. With diagnoses like autism, ADHD, allergies, and autoimmune disorders surging, Bigtree asks a simple but urgent question: what has changed? Backed by whistleblowers, personal testimonies, and an explosive unpublished study from Michigan's Henry Ford Health, the film exposes striking differences in health outcomes between just over 18,000 vaccinated and unvaccinated children. Data so stark it made meaningful statistical comparisons impossible in some key categories like diabetes, ADHD, learning disabilities, tics, and more. Joining me now to unpack the findings and what they mean for every parent and policymaker is Bigtree himself. The Henry Ford study found that vaccinated children are 2.5 times more likely to develop chronic illness. And for parents navigating these heavy vaccine decisions, this is really a bombshell. How do you respond to those who dismiss this data as though it's, that typical mantra of correlation doesn't equal causation? And what would you say to parents who are told to trust this system, even when that system won't allow for this proper scrutiny?
Well, look, that's why we've made a film about this study called An Inconvenient Study, so that people can really understand the history behind why what makes this study so important. But very quickly, all of the childhood vaccines that we're delivering to our children are sort of based, especially up in Canada, based on the American, investigation or science, if you will, or lack of science. So you have to understand what we have proven with my nonprofit, the Informed Consent Action Network, over the last 8 years through lawsuits against our government and everything else, is that they've never done a proper safety study of a childhood vaccine prior to licensure. That would be a placebo-based study in a randomized control setting. That is the gold standard of science. It's never been done, and they're dancing around this now. We've got them on the, we've got them on the hot tin roof at the moment, dancing, because they're trying to say, well, we can't do placebo studies now because there's vaccines that already cover these diseases, and to do a placebo study while we have something that works would be unethical. But what they fail to tell you is that the original version of that vaccine, the very first vaccine, was never tested against a placebo. So we've never, ever established safety in this vaccine program. So that's why, when someone wants to poke holes at the Henry Ford study, which they should, that's the scientific method. We want all the challenges. And so people should know, I want to state for Henry Ford, we've received a cease and desist letter claiming defamation for this film, because they'll say the reason that this Henry Ford unpublished study was not published was because the data wasn't good, or that the methodology wasn't right. But if you watch the film, I had hidden cameras recording the head of infectious disease from Henry Ford, that was the main author on this study. He says to me, without coercion of any kind, it's a good study. The world needs to see it. I can't put it out, or I will lose my career. I'd be finished. So you're well aware up in Canada of the types of pressures now that's upon any doctor, anyone that wants to step out. This Henry Ford is one of the top research hospitals and systems in the world. The head of this study, the vaccinated versus unvaccinated study that's at the heart of this, he ran the Moderna trials for Henry Ford. So he was a huge part of approving the Moderna vaccine. So all of this to say that we have a real problem now because Henry Ford is not the only vaccinated versus completely unvaccinated comparative study that we've seen. There's several others. There's one by Dr. Brian Hooker and Neil Miller. There is one by Dr. Paul Thomas that was done on all of the patients in his very large pediatric practice where he compared vaccinated to unvaccinated. There's a couple by Dr. Andrew Mawson from the University of Mississippi that did a homeschool study. But what I can tell you is this. The Henry Ford study is mirroring those other studies. In fact, of every study that's ever compared the health outcomes of vaccinated versus unvaccinated, we are seeing what we call reproducible science now, which means it's coming out with, a similar signal. And that signal is that the vaccinated are the sickest. If you compare the vaccinated to the unvaccinated, the vaccinated are doing far worse. And you can see that in all those other studies. And so now Henry Ford, this study really is alarming because it's the first time we've seen a study like this done by what I would call our opposition. Those of us that have been, a part of the vaccine risk awareness movement or medical freedom movement or MAHA, whatever you want to call us. We've been saying, look at the Neil Miller study, look at the Brian Hooker, and, look at all these other studies, but we've never seen a medical institution that is clearly states that is pro-vaccine. Dr. Zerbo says over and over again, I'm pro-vaccine. I'm the reason they have a mandated vaccine program here at Henry Ford. This is all in the film with the recorded footage that we have. But we really believe he did this study to prove us wrong. He did this study to prove the other studies wrong, which is, honestly, if that's what you've done and you come out with the same result, I think that is very, very powerful scientific evidence. And now we've really got to think about it. And remember, this study wasn't seeing like a 20% increase or 50% increase or 80% increase in chronic disease. It was a 250% increase in chronic disease. Neurodevelopmental disorders, nearly 5.5 times the amount. So a 550% increased risk of having a neurodevelopmental disorder. We have gone from 12% chronic illness in the 1980s in America to now over 54% of our kids are chronically sick. That is the greatest decline in public health that's ever been recorded. That makes us the sickest nation in the industrialized world, and it makes this generation of children the sickest generation of children America has ever seen. So no one gets to be a hero here. Tony Fauci is no hero. No former HHS secretary is a hero here. Someone has overseen in our regulatory agencies the greatest decline in human health ever recorded.
And I would say that clinging to ethics, that it's unethical to do a truly randomized placebo-controlled study. The inverse is true, where it's actually unethical now at this point, in light of all of this data, to conduct such a study. But as we heard repeatedly throughout the documentary, Dr. Zervos, he's nervous that this study and releasing it would destroy his career. And so what does that say about Big Pharma's stranglehold and the capturing of institutions that are supposed to uphold this kind of ethics-based research?
We see it everywhere. We see it all over the world. We see it in all of the published studies that are being done around pharmaceutical products. Virtually every editor of a peer-reviewed magazine, whether it's, the British Medical Journal or New England Journal of Medicine, they all end up coming forward and saying, more than 50% of the science that is being published in this magazine cannot be reproduced. And so it's all being driven by funding. This is why I really love some of the work that Robert Kennedy Jr. is doing at HHS. Jay Bhattacharya is now the head of NIH. And what he has stated is we are no longer going to laud import or importance upon, the Lancet or British Medical Journal getting published in these big journals because it looks like you can buy that publishing. What he said is what we are going to tout are the best studies are the ones that can reproduce their results multiple times, get published multiple times. That's going to put you at the top of the pile, not who you were reported by, but how many times you've been able to show this result. And so I think that that's a huge sea change in science. It should have been from the very beginning. That's a no-brainer. And as you pointed out, the pharmaceutical industry has absolutely corrupted the entire scientific space around drugs and vaccines. They own our television set here in America. I'm not so sure that that's the case in Canada, but they also have government subsidies. They're putting in politicians. And so even if you have a government media system, those people are all getting their jobs funded. They're getting their elections paid for by the pharmaceutical industry. It's the most powerful lobby in America. It's the most powerful lobby in the world. And so one of the things we saw with Tony Fauci at NIAID was his ability to control the narrative. He gives billions of dollars out, or was when he had that position for the last, I don't know, was it 3 or 4 decades, to universities that will sort of carry the water for the pharmaceutical industry. And anybody that we ever saw that would do some sort of study to question the safety of vaccines, funding would be stopped to that university, or sometimes more funding would come in and we would watch them fire that professor. But it's the use of finance through pharmaceutical controls that really needs to be broken apart, because it is contaminated science, and we're no longer working by the scientific method, which is any question is open. We are open to all challenges. Go ahead and challenge our new product, challenge our hypothesis, and see if you can poke holes in it. Now you're a heretic if you decide to try and poke holes in our science. And as Tony Fauci said, if you're questioning me, you're questioning the science, only to sit before our own Congress a couple of months after saying that and admitting that social distancing was completely arbitrary and made up and had no basis in science.
It was felt that the transmission was primarily through droplet, not aerosol, which is incorrect, because we know now aerosol does play a role. That's the reason why they did it. It had little to do with me, since I didn't make the recommendation, and my saying there was no science behind it means there was no clinical trial.
He had no ability to provide any science behind wearing masks. All the science across the world showed that the COVID particle was far too small to be stopped by the masks. The vaccine was going to stop transmission, which it wasn't. It didn't. I reported that from day one, because the FDA said the very first day the studies were, over moving into emergency use authorization, these studies did not determine whether it stops transmission. So we've been lied to on a massive scale, and so many people know it, which is why I have hope. I have hope that we're waking up. But what this film shows you is it wasn't just the COVID vaccine. This is how every vaccine has gotten onto the market. And our children are really suffering because there is not good science behind this. In fact, there is no science. It's a pile of steaming assumptions that have been made with no science, and they're trying to block any science from being done. And then studies like this that are retrospective, they try to poke holes in it. And what we're saying is, don't poke holes in the studies now. There's too many of them showing the same signal now. You have to do a vaccinated versus unvaccinated study and show us a different result. Show us you can do this study and show that the vaccinated are healthier. That should be the easiest study in the world.
Vaccines in general are still such a sacred cow, and it is so taboo to simply even just question them. But if the regulatory bodies continue to stonewall basic scientific inquiry, and as mentioned, in light of all of the scientific research, how will you ensure that other institutions, whether it be Kaiser Permanente, the CDC, or perhaps any entity with a backbone, will replicate and publish this information that the establishment clearly wants buried?
We just keep following we pull on every thread we can find to see if we can get this sweater to fall apart. Wherever we look, we are deeply involved on the legal front too. We spend millions of dollars every year suing the government or suing agencies. We currently have a very important lawsuit in West Virginia. We're fighting to bring back the religious exemptions so that people in Virginia can opt out, in West Virginia can opt out of the vaccine program for their kids. We won that same case after 3 years of trials in Mississippi. So we are trying to bring back freedom. I believe you should have choice. I want to be clear. I'm not trying to take vaccines away from anybody, but I believe that you should have choice, and you should be informed. That's why we called our nonprofit the Informed Consent Action Network, based on the Nuremberg Code and the first rule of informed consent. That the voluntary consent of the patient is absolutely critical in a modern society, and they must be informed both of the positive benefits of any procedure or product and the negative side effects and possible issues. And what I know for a fact is every vaccine is arriving at your doctor's office with a warning label wrapped around it. It has all sorts of horrific, serious side effects, including Guillain-Barré syndrome, which is a paralytic disease, transverse myelitis, paralytic disease, multiple sclerosis. They know these things. They're not telling these things. I think the biggest one Almost all of them say encephalitis, meaning your baby's brain swells in their head. It gets too big, just like they've been in a car accident, a major brain trauma. And when that brain stops swelling, many times they lose the ability to speak. They lose the ability to walk. They start having seizures. I made the documentary Vax, which was about autism. This is now about every child. Every one of us, that is vaccinating has a child at home. If you have a couple children, odds are one of them has eczema, one of them has asthma, one of them has lupus, one of them has some gut or bowel disease, one of them has diabetes. I mean, it's just going on and on and on. And when you look at this study, when you see this film, it's so clearly laid out. It's very reasonable. We bring the receipts in this film, and it's short and sweet and to the point. So anyone that wants to see it, all you have to do is go to inconvenientstudy.com. It's represented for free. It's promoted and funded by our nonprofit. We want everyone in the world to see this film and to share this film.
If you would like to see more reporting like this, but specific to the COVID-19 injectables, please head over to nomoreshots.ca. There you can find evidence-based reports on the topic and even call on our Minister of Health to revoke market authorization for these injections. That's nomoreshots.ca.